SSA looks after elderly people. It's an old people's home, and it's currently looking after about 25 elderlies, of which only 2 are female, the rest are male. There are quite a number of challenges faced by the elderly in the communities, and though I work for SODA, which is the old people's home, I would like to say that these challenges are faced by elderlies in general, including those that are within the communities, within the community in the households. The challenges are those especially of access to drugs, healthcare in general, because sometimes they can manage to go to hospital, they consult, but at the end of the day, they are just sent back home with prescriptions, and they are unable to buy the drugs, which becomes quite a challenge. And the issue of nutrition is also another challenge for the elderly, as well as other challenges that the elderlies are faced with, which are not well pronunciated, so to speak, which are sort of alien to our communities, issues like depression and that sort of thing.
Could you maybe tell us a bit more about depression among older people from your experiences of working with them?
Okay. You would find that a lot of them are very reserved. They are just quiet most of the time. It's as if they think a lot about their situation, about being institutionalized. They miss their family. They miss being part of the community, and so on and so forth. And even those within communities that are not in an old people's home, like at SODA where I work, you'd find that the symptoms are the same. They also they are withdrawn. And I think at the end of the day, all that leads them to being depressed, and it leads to them just isolating themselves from the community and making them feel like they don't belong anymore, they don't matter anymore.
And is there anything, what do people do to help themselves if they find themselves with depression? Is there any sources of help available?
Unfortunately, I don't think so, because I think the biggest challenge is that of us as caregivers within institutions like the old people's home I work for, or caregivers within households at community level, not being able to diagnose, so to speak, that what this elderly person is suffering from is depression. So you then find that there are various interpretations to the kinds of behavioral characteristics that they'll be showing. So I think it's quite a challenge, that ability to be able to tell that this is depression. It's not there yet from a layman's point of view, just as a basic caregiver.
Thank you. And so we've been now at this workshop for 2 days, and we've been talking about ICOPE-DEP and planning our work together.
Yes.
Can I just ask you what you enjoyed most about the last 2 days, about the workshop?
Well, I'm not sure if I have a particular area to say this is what I enjoyed most, because I've just been enjoying the whole workshop right from the onset, because it's been very eye-opening. I've been learning so much from the other participants from South Africa and Ethiopia. I've been learning so much from the professionals, the medical side of things, because we are lay caregivers, but we've come to learn a lot about the issues surrounding the elderlies from a medical perspective. And like, for example, the issue of depression that I talked about earlier, we got to understand it better, and we realized also that it's something that needs to be looked at further, so that also the elderly are able to be assisted to have that treated.
And what do you hope will come out of our work in the future?
I really, really do hope that this research team gets all the necessary supports it needs, from funding to what have you, so that at the end of the day we then have the interventions, being put in place for the elderly people, so that we do have more research being done on these silent issues that affect the elderly, like the issues of depression, dementia, and that sort of thing. So we really hope that we will, as we go further, get to have another workshop, or at least feedback to that will show the fruits of this workshop and the work that is being done, where at the end of the day this pays off by then having the necessary interventions being taken out there, to the elderly in particular, so that they have a quality life even in their old age.
That's great. Thank you very much, Emilia.
Thank you so much.